Extract 1. Questions 1 to 12. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
So tell me what it is that bothers you about your skin.
I'm starting to get some crow's feet here, and obviously I'm trying to hide the age a little bit. So along with the fact that I have some wrinkles here that it seems, whenever I smile or frown, I'm tending to get these wrinkles, but it's the fact that they're still a little bit permanent right now. Even when I'm not making any expressions, I still see the residuals of that. So I kind of want to make those disappear.
Perfect.
Whenever I smile, I feel like these crow's feet tend to make my eyes look a little bit smaller.
Sure.
So along with the fact that, even when I'm smiling from here, I'd like to have a little bit more lift.
Okay.
So whatever it is that we can do to fix that.
Sure, absolutely. What you're noticing when you smile, there's a muscle that goes around your eyes here that squinches when you smile, and that gives you the lines that are perpendicular to that muscle. But it also closes your eye a little bit because it forces the downward motion of your eyebrow, which is also kind of closing down the outer portion of your eye. We can actually use Dysport, which is a medication that helps to relax the muscle so that when you smile, the muscle won't squinch here.
Okay.
That'll actually keep your eye open when you smile, which I think you'll like. It'll make you have a wider eyed appearance. It'll also lift your lateral portion of your brow up a little bit if we treat this area. It's done with 3 simple injections on either side of the eye into that muscle. It doesn't really hurt much. It's a little tiny pinch. The medication usually takes between 3 to 5 days to set in and work, so you won't see immediate results today, but you should notice something by a week from now. If you were to still feel that it was moving in a week from now, come on back in, let me take a peek at it since it's the first time you're having this done, and I can let you know if the muscle needs a little bit more of the medication. That medication, the Dysport, then lasts for about 3 to 4 months in most people, but during that time when you're not able to crunch the skin, your skin's always making collagen and it's always being broken down, and if you're not able to scrunch the skin up from the muscle action, it won't get those deep lines in it, so you can make more collagen to even fill in those lines that you're starting to see at rest. So there's a bit of prevention with using the Dysport around the crow's feet to prevent them from getting deeper. Same thing with your forehead. It's a different set of muscles that helps to lift up your brow. Now, because I need your brows to still lift a little bit, we don't want to leave them lying flat because then I think you're going to feel that your upper eyelid feels too heavy. So what we can do is we can treat your forehead muscles, the frontalis muscles here and here, with a little bit of the Dysport, but we'll still allow you to have some movement. Men usually don't like to have a frozen look. They want to have some animation with their eyebrows, but I can give you a lighter treatment so that you can still move your brows, but you won't have the deep crevices in the skin when you do that. And again, by letting the muscle relax, the skin will then start to fill in collagen and fill in those lines so you don't see those lines at rest. It may take more than one treatment with the Dysport for that to occur because it takes several months to build up collagen, but over the course of a year or a year and a half, you should virtually see those lines disappear. If you were someone who had much deeper lines, it might take more like 2 or 3 years for that to occur, but since your lines are very fine, I don't think you're going to have any problem with having them improved with even just one treatment.
Sounds great. My pictures, I'm tending to see my eyes always a little bit on the squinchy side. So
small, yeah.
This sounds excellent. Is there anything I have to do after the injections
It's a great question. So what we ask you to do is to move the muscles to work the medication into the nerves that drive the muscle action. So all that would entail is lifting up your eyebrows a few times in the next hour and a half or so. You don't have to do it all day long. You don't have to do it for 4 hours. If you did it 5 times in the next hour and a half, that's probably plenty. And then also smiling so that you can squint the side muscles on your eyes as well for the next hour and a half. Other than that, the only thing we ask you not to do is have a facial massage today because we don't want the medication to be moved to any other muscles in the area. But you could work out, you could do yoga, you can do anything you normally would do except for having a facial massage for the next 10 hours. You can lie down, you can take a nap, any of those things are fine.
Simple enough. I think I can abide by those rules.
Great. Do you have any other questions at all?
That's it. Thank you very much.
Then we'll get started.
All right. Excellent.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks?
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah.
Do they wake you up at night?
About 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Well, dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
No?
Are you doing any exercise? Jogging, for instance?
No.
What about pets? Do you have pets at home?
No. But my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses?
No,
High blood pressure, diabetes, or heart problems?
nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now look at
Now you will hear a talk about ambulatory nursing care.
Ambulatory nursing care requires critical reasoning and astute clinical judgment in order to expedite appropriate care and treatment, especially given that the patient may present with complex problems or potentially life-threatening conditions. Ambulatory care registered nurses provide care across the lifespan to individuals, families, caregivers, groups, populations, and communities. Ambulatory care nursing occurs across the continuum of care in a variety of settings, which include but are not limited to hospital-based clinic centers, solo or group medical practices, ambulatory surgery and diagnostic procedures centers, telehealth service environment, university and community hospital clinics, military and veterans administration settings, nurse-managed clinics, managed care organizations, colleges and educational institutions, freestanding community facilities, care coordination organizations, and patient homes. Ambulatory care registered nurses interact with patients during face-to-face encounters or through a variety of telecommunication strategies, often establishing long-term relationships. Telehealth nursing is an integral component of professional ambulatory care nursing that utilizes a variety of telecommunications technologies during encounters to assess, triage, provide nurse Now you will hear about cleaning patient care equipment.
Cleaning is the act of removing visible organic residue, e.g., blood and tissue, and inorganic salts from patient care equipment, and preparing it for safe handling and further decontamination. Cleaning should be accomplished using water with detergents or enzymatic products that are capable of removing visible organic and inorganic residues. In home care, cleaning is done manually with friction, i.e., rubbing or scrubbing the soiled item by hand with a cloth to remove soil and fluidics, i.e., using a detergent or enzymatic product with water, a technical way of describing the process of cleaning by the good old soap and water method. Another cleaning method is mechanical cleaning and can be accomplished through a washer disinfector, e.g., dishwasher. Patient care equipment must be thoroughly cleaned before it can be disinfected. This includes getting into the nooks and crannies, i.e., in crevices, serrations, joints, and lumens of instruments, devices, or equipment. Patient care equipment should be cleaned as soon as practical after use in the home. Before cleaning, inspect the equipment's surfaces for cracks or breaks in integrity that would impair either the cleaning or disinfection process, and throw out or repair any equipment that cannot be properly cleaned and disinfected. Decontamination is the use of physical or chemical means to remove, inactivate, or destroy pathogens on a surface or item to prevent transmission of infectious agents and render the item or surface safe for handling, use, or disposal. OSHA, 1991.
Now you will hear about nasal foreign body removal.
Nasal foreign bodies are a commonly encountered problem in acute practice. Personal experience and previous studies have shown that they occur predominantly in children between 2 to 5 years old. Children under the age of 5 years have difficulty in nose blowing. Treating this age group of children is challenging, first because of their natural fear of the unknown, and second as they are difficult to restrain. Their unwillingness to cooperate is often exacerbated by previous painful attempts to remove foreign bodies by either parents or other medical professionals. Various methods for foreign body removal have been described, such as using a wax hook, old Eustachian tube catheter, Foley and Fogarty catheters, cupped forceps, hemostats, wiry ear loops, and cyanocrylate glue. All these methods are invasive, can cause trauma to the nasal mucosa, and have the potential risk of further displacing the foreign body with possible aspiration. Several positive pressure techniques have also been described, e.g. using bag valve mask apparatus, oxygen tubing attached to the unoccluded nostril, but none have been widely accepted for regular use. These maneuvers aim to build up positive pressure behind the foreign body, which would then force it out of the nostril. The parent's kisses is a unique method which works on the same principle but does not require the child to be restrained and can be performed by the parent without any physical contact from the attending doctor. The technique was first described by Tiber in 1965 and involves the parent exhaling whilst kissing their child and occluding the unaffected nostril. During this procedure, the glottis is closed, so there is little risk of barotrauma, as with other positive pressure techniques. Moreover, the pressure used is low. It would be comparable to that generated during sneezing, which is about 60 mmHg. The aim of this study was to evaluate the effectiveness of the parent's kisses for removal of nasal foreign bodies in children, and to determine if this technique reduces the number of children requiring general anesthesia.
Now you will hear about vaccination.
Excluding children from your practice when their parents decline immunizations is not recommended. It can put the child at risk of many different health problems, not just vaccine-preventable diseases. Remember, unvaccinated infants did not decide for themselves to remain unvaccinated. They need your care. Make sure that parents are fully informed about clinical presentations of vaccine-preventable diseases, including early symptoms. Diseases like pertussis and measles are highly contagious and may present early as a nonspecific respiratory illness. Parents who refuse vaccines should be reminded at every visit to call before bringing the child into the office, clinic, or emergency department when the child is ill, so appropriate measures can be taken to protect others. When scheduling an office visit for an ill child who has not received vaccines, take all possible precautions to prevent contact with other patients, especially those too young to be fully vaccinated and those who have weakened immune systems. If a parent refuses to vaccinate, you can share the fact sheet. If you choose not to vaccinate your child, understand the risks and responsibilities, which explains the risks involved with this decision, including risks to other members of their community, and the additional responsibilities for parents, including the fact that, when their child is ill, they should always alert healthcare personnel to their child's vaccination status to prevent the possible spread of vaccine-preventable diseases. You also can tell the parent that you would like to continue the dialogue about vaccines during the next visit, and then make sure to do so. You may wish to have them sign a refusal to vaccinate form each time a vaccine is refused, so that you have a record of their refusal in their child's medical file.
Now you will hear a nurse talking about the role of nurse in wound care.
A nurse who recognizes the early signs of skin disruption can help keep a small problem from turning into a big one. To recognize wounds early, nurses must understand where patients have the highest chance of developing a wound and check that area daily. Diabetics, for example, often develop wounds on their feet because of poor circulation and nerve damage. The elderly and debilitated often develop pressure ulcers, open areas on the skin that develop from lying in one position for too long. Some wounds, such as surgical incisions, are inevitable, but complications such as infection are not. Other wounds, like pressure ulcers, are preventable with good nursing care. Nurses can decrease wound complications by being proactive about prevention. They can frequently turn patients and examine common wound sites, such as the back and the hip bones. Scrupulous handling and care of wounds helps prevent contamination and possible infection. Good nutrition also helps wounds heal. Education, always a big part of nursing care, teaches patients and families how to avoid complications from wounds.
Now you will hear about the usage of peak flow meter.
A peak flow meter is a small device that helps you check how well your asthma is controlled. Peak flow meters are most helpful if you have moderate to severe persistent asthma. Measuring your peak flow can tell you and your healthcare provider how well you blow air out of your lungs. If your airways are narrowed and blocked due to asthma, your peak flow values drop. You can check your peak flow at home. Here are the basic steps. Move the marker to the bottom of the numbered scale. Stand up straight. Take a deep breath. Fill your lungs all the way. Hold your breath while you place mouthpiece in your mouth, between your teeth. Close your lips around it. Do not put your tongue against or inside the hole. Blow out as hard and fast as you can in a single blow. Your first burst of air is the most important, so blowing for a longer time will not affect your result. Write down the number you get. But, if you coughed or did not do the steps right, do not write down the number. Instead, do the steps over again. Move the marker back to the bottom and repeat all these steps 2 more times. The highest of the 3 numbers is your peak flow number. Write it down in your log chart. Many children under age 5 cannot use a peak flow meter very well, but some are able to. Start using peak flow meters before age 5 to get your child used to them.
That is the end of Part B. Now look at Part C.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best, according to what you hear. Complete your answers as you listen. Now look at Extract 1.
In this part of the test, you'll hear a short talk on consumer health literacy.
Health literacy is defined as the degree to which individuals have the capacity to obtain, process and understand basic health information and services needed to make appropriate health decisions. Improved consumer health literacy is considered to be an important component of health communication, medical product safety and oral health. Health literacy includes the ability to understand instructions on prescription drug bottles, appointment slips, medical education brochures, doctor's directions, and medical consent forms. It also includes the ability to negotiate complex healthcare systems. Health literacy is not simply the ability to read. It requires a complex group of skills including reading, listening, critical thinking skills such as analysis and evaluation, as well as the ability to apply these skills within their own health context. Health literacy varies by context and setting and is not necessarily related to years of education or general reading ability. A person who functions adequately at home or work may have marginal or inadequate literacy in a healthcare environment. In recent years, there has been a move towards a more consumer-focused healthcare system. This is part of an overall effort to improve the quality of healthcare and reduce healthcare costs. As a result, individuals need to take an even more active role in healthcare-related decisions. Skills needed for health literacy. Patients are often faced with complex information and treatment decisions. Some of the specific tasks patients are required to carry out may include the ability to evaluate information for credibility and quality, analyze relative risks and benefits, calculate dosages, interpret test results, or locate health information. In order to accomplish these tasks, individuals may need to be able to understand graphical information. With the development of the internet as a source of health information, health literacy may also include the ability to operate a computer, search the internet, and evaluate websites. Oral language skills are important as well. Patients need to express their health concerns and describe their symptoms accurately. In an age of shared responsibility between physicians and patients for healthcare, patients need strong decision-making skills. According to recent studies, poor health literacy is a stronger predictor of a person's health when compared to the standard measures of age, income, employment status, education level, and race. It has been reported that nearly a third of the adult population in Australia have difficulty understanding and using health information. As a result, patients often take medicines at an incorrect time. They also miss follow-up appointments and may not understand simple instructions like take on an empty stomach. Vulnerable populations to low standards of health literacy include elderly, people on low incomes, migrants, people who did not complete secondary education. According to healthcare research, low health literacy is linked to higher rates of hospitalisation and higher use of expensive emergency services. This is supported by examples in diseases such as cancer and diabetes. Low literacy adversely impacts cancer incidence, mortality, and quality of life. For example, cancer screening information may be ineffective. As a result, patients may be diagnosed at a later stage. Treatment options may not be fully understood. Therefore, some patients may not receive most suitable treatments. Informed consent documents may be too complex for many patients, and consequently, patients may make poor decisions about accepting or rejecting interventions. Diabetes. Among primary care patients with type 2 diabetes, inadequate health literacy is independently associated with worse glycemic control and higher rate of retinopathy. Lack of health clinics may increase diabetes-related problems among disadvantaged populations. Role of the consumer health librarian. Many consumer health initiatives are geared towards technological access to health information or rewriting existing health materials at a simpler language level. Both of these approaches are important, but limited. Easy-to-read materials and access to technology are only pieces of a process that must be placed in a larger community context. Consumer health librarians can actively develop partnerships with literacy groups providing basic adult education, providers of English as a second language, community-based organisations, public libraries, senior citizen facilities such as retirement villages and nursing homes, healthcare associations. Consumer health librarians also need to participate in supporting the direct needs of their clients by providing materials that are multilingual, culturally appropriate, and easy to read.
Now look at Extract 2, questions 31 to 36. You hear the guidelines given by the physician on how to cope up with Prader-Willi syndrome. You have 90 seconds to read questions 37 to 42. Rejection of kidney transplant. What should I do? Rejection is the primary and prominent complication that may arise after receiving the kidney transplant. Since the individual was not born with a transplanted kidney, his body will consider this new tissue is foreign, and as a result it will try to attack the new kidney to protect the body of the individual. Rejection is a common response of the body after the transplant surgery. Therefore, the patient must take appropriate anti-rejection medicine as prescribed to prevent rejection. There are two types of rejections that occur after the kidney transplant. 1. An acute rejection occurs usually any time during the first year of transplant and can be cured successfully, whereas a chronic rejection occurs gradually over years. The causes of chronic rejection are yet to be identified by the research, and the treatment of chronic rejection is often unsuccessful. Immunosuppressant or anti-rejection medicines decrease the natural immune response of the body to the new foreign organ. The medicines repress the immune system and prevent the body from rejecting the new organ. However, there are also chances of getting cervical, colon, and breast cancer in women and prostate and colon cancer in men. Significantly, it is very difficult to diagnose the kidney rejection in its early stages. Also, the rejection is often irreversible once it starts. Therefore, the organ recipients should never stop taking the anti-rejection medication even if they think the new kidney is functioning well. Discontinuing the anti-rejection medication will encourage a rejection to occur. The numerous side effects of the immunosuppressant or anti-rejection medications are usually manageable by the patients. Blood levels after having anti-rejection medications have to be examined regularly to prevent rejection and reduce the side effects. High blood pressure, weight gain, getting infections, and an increased risk of certain types of cancer are some of the common side effects of immunosuppressant medications. The three groups of immunosuppressant medications are induction agent, a powerful immunosuppressant medication given before the transplant or immediately after the surgery. Maintenance agents are the second group of immunosuppressant that have to be taken regularly throughout the lifetime. Rejection agents are the medications that are used for treating the kidney rejection. However, since the immunosuppressant medicines lower the immune system, there are high possibilities of viral and other infections. Therefore, diagnosing and treating the infections at the initial stage is the best method to maintain the body and the new organ healthy. It is very essential to wash the hands frequently or to use an antimicrobial gel during cold and flu season. The patient should report to the physician following any of these symptoms: sores, injuries, or wounds, especially those that do not heal, symptoms of urinary tract infection like a frequent urge to urinate, pain or burning sensation while urinating, reddish or cloudy or bad-smelling urine, symptoms of respiratory infection such as nasal congestion, cough, sore throat, and scratchy throat, running nose, or a fever. There are certain vaccines that will protect the body from infection. Also, certain vaccines are not good for a transplanted patient. For instance, the patient should avoid all live vaccines. Therefore, the patient should consult the transplant team before receiving any boosters or vaccines. The following are the common rules for receiving vaccines such as live vaccines, a flu shot, or hepatitis B. Hepatitis B should be received before transplant. Should avoid all live vaccines. Should avoid the nasal influenza vaccine. Should wait for at least 6 months after transplant or receiving a flu shot. Afterward, get a yearly booster injection. The patients who receive a live vaccine should avoid direct contact with the children received oral polio vaccine for 3 weeks. The children received measles or mumps vaccines. The adults received attenuated varicella vaccine to prevent zoster. The adults or children received the nasal influenza vaccine. The recommended vaccines are Haemophilus influenza B, diphtheria pertussis tetanus. Hepatitis B is safe before transplant. Hepatitis A should be given before traveling. Neuromax, single booster after 5 years of transplant. Influenza types A and B yearly. Inactivated polio. Meningococcus. Typhoid 6. The following live vaccines should be avoided: varicella zoster, smallpox, live oak typhoid, TY21A, and other newer vaccines, intranasal influenza, Bacillus calmette-guerin, yellow fever, mumps, rubella, oral polio, live Japanese bee encephalitis vaccine, and measles, except during an outbreak. The patient may develop diabetes after the transplant even if he did not have any diabetes earlier. This kind of diabetes is known as new onset diabetes after transplant, or NODAT, that can occur as a side effect of the anti-rejection medications. Kidney recipients are often at greater risk for heart disease. The many causes for heart diseases are diabetes, smoking, hypertension, overweight, high cholesterol, blood lipids, hypertension, and prolonged periods of dialysis. There are increased chances of cancer formation after the transplant. Therefore, it is very crucial to keep maintaining the immune system to prevent cancer formation. Since the immunosuppressive medications decrease the immune function, that will obviously decrease the defensive mechanism of the body against certain types of cancer, there are things that you can do to lower your chances of getting cancer. The most common type of cancer is the skin cancer that can result in the fatality of a patient. However, there are also chances of getting cervical, colon, and breast cancer in women, and prostate and colon cancer in men. That is the end of Part C. You now have 2 minutes to check your answers.